if they want socialized medicine, they can go to another state and live. But here in the state of Tennessee, we're not moving towards socialized medicine. We're not moving towards socialism.
Welcome to Policy, Not Politics. I'm your host, Ralph Bristol. Today, part 2 of my interview with State Representative Cameron Sexton, the chairman of the Tennessee House Republican Caucus, who's leading an effort to pass multiple bills under the heading of the CARE Plan, an acronym for Consumerism, Access, Rural, and Empowering. And it does appear that an increasing irritation in Tennessee and probably other states too is the decreasing availability of healthcare services in the rural areas. Does your bill address that particular problem in any way, or do
it
any
does?
Of the bills?
I mean, it does. We have a certificate of need process in the state of Tennessee where the government has to approve you to go do anything that you want to in any community across the state. We think it's over-regulation. We think it limits the marketplace and limits competition. So we'd like to open the doors of that in the rural areas where if a physician wanted to put in an imaging center in Salina or Huntsville, Tennessee, in Scott County, why can't they? Especially if there's not one there and the patients have to drive 45 minutes. If somebody has a mobile imaging machine and they want to bring it up to Scott County so you don't have to drive 45 minutes, why do they need state permission to do that? And it's those kind of things that when you look at it in the rural communities of government even causing a bigger burden on them to lose health care dollars. And in a lot of places in Tennessee where these rural hospitals are struggling, you've had multiple rural hospitals within 15 to 20 miles of each other, and that rural community can't sustain 2 hospitals. And so what happens is one stays open and the other one turns into a freestanding emergency room or a diagnostic center.
If you are able to pass this, and that I would guess seems fairly likely since Tennessee is a very heavy Republican state with a Republican governor, do you have a defined goal and a measurable goal so that once this is in place, and it's been in place for a number of years, we can measure it to see whether it's working to accomplish what it was supposed to? And can you give us a definition of what that is that it's supposed to do?
I mean, that's a great question. So it's a broad thing. So the success would be if we phased out or limited the certificate of need in the state of Tennessee and see how many things had popped up over across the state to provide more services to our areas. The all payers claim database, I think, would be the single most thing that would empower the consumers or the patients to uncover what their costs are and how to better shop for their health care dollars. I think PBM reform is part of that. And in Kentucky, they had an audit that came out just
PBM.
Pharmacy Benefit Managers, which is Caremark, CVS, Express Scripts. And most of those are owned by insurance companies now, so they get you coming, they get you going. In Kentucky, they just did an audit where they found $120 million that their PBM has to reimburse the state of Kentucky back. And so we have PBM reform on the list. And
does that include price controls? Because I think part of President Trump's plan includes price controls for pharmaceuticals.
Yeah, well, here's the thing is there was another PBM, and the article came out about that. It was part of United Healthcare's PBM, where a drug company was wanting to lower its cost. They wanted to lower the cost of their drugs on that formulary. The PBM told them you can't do it for 2 years because we have to figure out how to affect our bottom line. And by the way, the rebates has to say the same percentage of what you were giving us before. So you had a drug company who was willing to lower costs, and the PBM's telling them they can't for 2 years. So at the end of the day, who is more in control of the costs in the drug market? The pharmaceutical companies or the PBMs? And I would say with the 90-some-odd% of Tennesseans who currently have insurance, who have a PBM coverage or pharmaceutical benefit coverage, is those rebates that get kicked back to the PBM are not being returned back to the consumers. They're keeping them, and that's why the insurance companies are buying the PBMs. They're not buying them just because they want to have access to the drugs.
Right.
They're buying them because there's a huge profit margin, which is fine. We're not against profit, but you also have to return some of those savings back, and then there needs to be more transparency in there of really what's going on.
Do you think that increased transparency is going to result in lower cost for drugs and other services?
I think it will. I really think it will, because people can make those determinations for themselves. It works everywhere else. When you shop a car, you can buy the same car and go through different dealers, and you can shop, and you can have them negotiate with one another if that's what you want to do. You know, last year we passed a bill which on pharmacy, which is the PBMs were forcing the pharmacists to charge you your copay even if the cash price was less. They refused to allow the pharmacist to even tell you that. And we had to pass a bill that said the pharmacist could tell you which one was cheaper and you could pay the cheaper amount. So you have PBMs who you might have a $50 copay where you think that's great, right? You're like, oh, that's wonderful. But you could have gotten a generic for $12. But they were what it was called is they were gagging the pharmacists where they couldn't tell you it was $12. And I had a conversation with the pharmacist last night who was telling a patient, you don't need that because they're charging you $95 and I can sell it to you for $40.
Let me tell you a short story about my own experience with pharmacists. I've been taking the same heart medicine for high blood pressure for years and years, and I've never questioned the cost, and the cost keeps changing, and I never know what it's going to cost when I go to pick up my prescription. I just discovered that there's a website called, I think it's GoodRx. You can go and download a coupon and take it to various pharmacies, and my medicine went from the last price I paid at the pharmacy before I discovered this was $144. The last time I paid $16 for the same medicine just by downloading this free coupon from GoodRx. If there is that much difference in cost just depending on very little consumer effort, too late on my part, but better late than never, is this part of what more transparency and pricing can do, is to create that kind of competition that would just naturally, and how do the pharmaceutical companies put up with that if it dramatically reduces the cost of these drugs? Can they take that much of a hit?
Well, yeah. Well, the thing is, at the end of the day, you're not buying that directly from the pharmaceutical company. So those margins are already built in, and so they charge the wholesaler a cost who then does this and does this. So the whole process at the end of the day. What I will say on those coupons, a lot of times those are put out by the pharmaceutical companies to help people to save some additional money. But what I will tell you too is if you go back to this PBM problems that we're having, is you have that coupon. Let's say that you're on Medicare Part D and you have that donut hole, and when you hit that number, you have to pay those costs yourself. So if they give you that coupon to help you because your medicines are so expensive, guess what? The PBMs will not allow that to be used against that donut hole because they don't see that. And so they are the ones who are forcing and driving the higher costs, in our opinion, in the state of Tennessee for drug prices. Until we can get the PBMs under control, it's going to be very hard to control anything else.
Now, the reaction from the Democrats in the General Assembly has basically been, this is just another effort and excuse to not accept the expansion of Medicaid, which is the real solution to the problem.
Well, I mean, to them, if they want socialized medicine, they can go to another state and live. But here in the state of Tennessee, we're not moving towards socialized medicine. We're not moving towards socialism. We are moving to a marketplace that empowers the patient, that puts the patient at the center of the healthcare system, not on the outside. And we don't want insurance making the decisions for you. We want you to be making those for yourself. And if the Democrats disagree with that, then this is not the right place for them to live.
Are there any other key parts of this bill that we haven't discussed yet that we should?
To go back to your rural thing, Representative Kevin Vaughn from Memphis has been working with the different teaching hospitals in the state of Tennessee and the med schools. Because in the state of Tennessee, if you can imagine, we train or educate more individuals to become doctors than we have residency programs. And what is the issue there is if we don't have enough residency programs, they go outside the state. And once they go outside the state, very rarely do they come back in. So he has a bill that would increase the number of residencies inside the state of Tennessee, but also would put in place an incentive program that if you go through this type of residency program and you have help, then we can have them serve in these underserved areas in rural Tennessee as part of that. And so it's a way to increase the number of physicians in Tennessee as well as getting them into the rural areas, which is highly important.
Representative Sexton, Cameron Sexton, Chairman of the House Republican Caucus. Thank you.
Thank you very much.
Appreciate your time. You've been listening to Policy, Not Politics, a podcast dedicated to discussion of the pros and cons of public policy with the leaders we elect to make policy for the people of Tennessee. I'm Ralph Bristol. Thanks for listening and for inviting your friends to do likewise. Just click that share button on Facebook, Twitter, or YouTube and watch for the next edition of Policy, Not Politics.